Hi, so we're the European Doula Network and two members of the survey team. I'd like to introduce you to Špela Peternel, Dr. Špela Peternel, who's got a PhD in biomedicine and has been contributing to our surveys for a number of years. We've been doing surveys on doulas. We've done surveys on postpartum experience of women in Europe, and we've also done a pilot study and now launched the main study on feedback on doula support, which is for healthcare professionals to tell us what their experience has been for them working with doulas, alongside doulas, and the effect that they feel it makes on parents, mothers, the families, and also the teams which they work with. So we have a few questions that we'd like to discuss with you to help you understand part of the process. Špela, would you like to say something?
Yeah, actually, the idea came from Debbie, who said, "Oh, we just need to do a survey so we will know what people think about us." But I think that the study showed us much more than just what people think about us. I think that we got really interesting results. Actually, the study was not a big one. It's around 250, a little less than 250 healthcare professionals, mostly midwives, responded, and they actually had to write things what they think, and we really were surprised at how positive the replies were.
Yeah, I mean, I guess that brings us on to one question is the issue of bias in the study.
Yeah, of course, there is a bias if we got majority of questions from people who we contacted because we know that we work with them. But on the other hand, those are the people who can actually get the response because they know who we are and how we do our work. So yes, it's a biased response from the people who maybe like us a little bit more, but at least they know what they're talking about. So yeah.
Yeah. And this was one of the things we took it to FIGO and to Midwifery Today. And, we met so many healthcare professionals who are like, well, actually, I haven't worked with doulas. When you look at the international scale, especially in Africa, it was, they were saying, we really like the sound of doulas, but, we don't work with them. So I can't answer your survey. So this year we're going to be also at EBCOG, and we're going to also in Europe, which is the doctors conference there, and in FIGO in Cape Town. So we're hoping that, we're going to see a difference and also a much wider sample this time from all the conferences that we're going to this year.
Yeah.
So
and the survey is also stated differently this time, so it's much easier to answer.
Yeah. So last time it was very much we don't know what the answers are going to be. So there were open-ended questions, which took, because the survey's in 10 languages, it took a very, very, very long time to process and then analyze. This time we have more questions where you can do the scale of agree to disagree. So we're hopefully also going to find more of the nuances of, because in some cases you might say, well, most of the time I'm working with doulas and I'm finding it's working really well, but occasionally there are the ones that work out of scope of practice, and getting that kind of idea of, how big an exception is this? What is the scale of any difficulties and challenges that we have?
Yeah. And what are the challenges, of course, that we have, because we need to improve our work with this. The next question about the doulas. Are they clinically trained or licensed? About the doula role, how do we work?
Yeah, so this is a question that many obviously healthcare professionals are very worried about. It's a name that's relatively new, even though it goes back to antiquity. It's been revitalized. And we are not medical professionals, so it's a non-clinical support. It's an emotional, practical, and informational support. And the doulas are trained because, in fact, one of the main things about being a doula is that we are not there to guide or give advice. The idea is that it's informed consent.
The doulas need to be aware of how to find information and how to give information forward. And in the medical environment, of course, in the hospital, the doula is not the one who is asking the question. Doula just needs to remind the people the parents who she's with, to know how to ask questions and to remind them when to ask questions if they want to feel this empowerment that comes with the decision making that they need to do during the process. And that is definitely important, and it is important for the continuity of care during the pregnancy, birth, and postpartum, that we can be there with the parent, because we are there from when they asked us for our support. But also in the birth room, we stay from the beginning of the birth to the end, even if the birth takes a few days, because we don't need to be there for medical reasons. So for the emotional support, it's not so important if we are not, collected.
Okay, and the big question, do doulas ever interfere with medical care?
Of course, there are always concerns about that, but the doulas should never interfere. In our code of ethics, there is a really, really strict rule of never interfering with parents' decisions, never interfering with the medical decisions. This is not our role. Our role is to just, if the birth does not go as planned, you should prepare your clients in advance during the pregnancy how the birth can go on its own way. And when they are prepared, they know how to react. They're very satisfied, even if the birth ends in a very different way that they plan.
Outcomes and care. What benefits did we find from the pilot study, and that we're hoping to find more detail on in the next study?
Yeah, we were surprised that 94% of the respondents actually observed the positive effects on mothers, such as feeling calmer, they're better informed, they're more emotionally supported, and 92% of the respondent also noted that actually doulas not just bring the benefits for the parents, but also for the medical healthcare teams, particularly improving the conversation and becoming like a bridge between parents and the medical personnel, because we know the parents, we know what they want, and it's much easier and quicker if we can help with that.
So how do doulas work within hospitals at the moment?
I think that at the moment, in many countries, doulas have really are becoming more and more recognized for what they do. Some midwives and doctors even stated that they would recommend doula for every birth, but majority of them definitely, which was even more interesting, if the birth gets more complicated, they would recommend a doula. Or if the person is has more risks for the birth, they would recommend a doula. So for me, this is a very interesting result. So for me, this shows that they understand how doula can support the clients if the birth does not go as planned.
And that's interesting when we know how uncertain birth can be, that
Of course.
even, what could be a very low risk birth could take a very, very different journey. So this is where, even though there's advocates for saying it should be in the high risk, well, maybe it needs to be there because of the uncertainty and the reassurance that that can bring to the mother and the couple and the birthing.
Of course. As you said, you never know which birth will turn its own way.
What about models that are effective for integrating or helping build collaboration between healthcare professionals and doulas?
I think that we should start talking with each other and having common educations or meetings that would enable us to understand what each role actually is, because also sometimes we all want to help women, but if we know what my role is, what the other one's role is, and if we are not walking around like on fire, then we can really easily help each other out. And that can be only done if we start to talk more, and maybe not just in the birthing rooms, but also outside.
Yeah, that's a great point. And I think that key point of dialogue being the beginning of better understanding, the misunderstandings that are out there is sort of actually speak to somebody, speak to the midwife, the doula, the doctor. And if you can get cross-disciplinary conversations going, that's the best. So hopefully these are all opportunities to get the dialogue going. And when it's not possible to attend these meetings, then it's fantastic if you can just, if you're a healthcare professional who's worked with doulas, send us your responses, tell us the good, the bad, the challenges, the benefits you see, what didn't work. We'd really like to hear all about it.
Yeah, we really need all the information, not just the good ones. That's usually they say, oh, you just want to collect the good ones. No, we also want to know what's not working, because then we can immediately put it in our curriculums, because we are also improving the curriculums of how the doula study should look like. So we are really trying to directly implement what we get to the doula trainings.
Absolutely. And this is why we've taken the pilot study to another level. This is why we're involved in so many conferences. This is a really big push for us this year. And what we're also noticing is that this data is who's asking these questions. So we're the ones asking the questions. We're also open to this dialogue. So listening is one of the key doula skills, and we're so happy to be able to extend this to healthcare professionals.